Our first growth priority is to expand capacity. We're actually in this really strange situation for a business that we struggle to make everything that comes in through the door. So sometimes we talk about wanting to generate demand and having salespeople, all of which we're going to do. But actually one of the biggest impacts we can make is to expand our capacity so that we can make more products for dentists and their patients. And there's a couple of key areas where that's really important. One is in orthodontic and having unlimited aligner capacity. And I think we've already done that in our orthodontic business through the investments we've made at Ashford in 3D printing and automated trimming. We can now take on more and more contracts and volume through that plant and our other orthodontic sites. But if you look in our prosthetic crown and bridge business, capacity for dentures, crowns, implant work is limited. And it's really limited by the number of people we have. And we all know that there's a limited number of dental technicians out there that we can recruit. So we need to recruit and train more dental technicians. I see us always employing more people. I don't see us employing less people. But we need to bring innovation to supplement that, to enable us to automate some processes so that we can make more product. So that's a key focus of the work we're doing. As you know, we invested in recruiting a technology and manufacturing director, Richard Illingworth, and he's really focused on bringing this alive, expanding capacity across the ALS group. And so we've already achieved that in orthodontics, but there's other areas that we're looking at. So dentures, digital dentures would be the first one. The second one would be crowns. These are two key areas where we can expand capacity across the group. And then finally, milling capabilities. So let's just talk about each of those. So as you know, the process for making dentures is very, very labour heavy. And we're always going to need those traditional techniques and skills of dental technicians in the denture process. But we can also make these prosthetics using digital workflows, either 3D printing dentures or milling dentures. Now, both of those need some advancements in terms of technique, but we're going to crack that at ALS. We're making investments now in both milled dentures and printed dentures, and we're going to bring those products to market. And in doing that, we're going to enable a growth in capacity across the group. So we'll be able to take in more dentures into our network and use that through our local laboratories and the dental technicians to supply to customers. So digital dentures, investment in milling and printing dentures is a key area of focus for us for expanding capacity. So crowns is a key area that we're looking to expand capacity to. So if you think about how we produce a crown, and a bonded crown, again, is a very labour-heavy product, and we will continue to supply bonded crowns for those dentists that want it. But transferring our customer base to a digital workflow for zirconia manufactured crowns in our lab network is going to dramatically increase capacity, and it will also increase profitability. Across our lab network, we have a variety of skills, but also different footprints in terms of manufacturing capabilities.